Have you ever looked at your cat and wondered, could my cat have a fever right now and I don't even know it? Cats are mysterious creatures, and one of their greatest survival instincts is the ability to hide illness. Unlike dogs or humans, cats rarely show obvious symptoms until they're really unwell. That means as pet parents, we need to pay closer attention, and sometimes the most reliable way to know what's going on is by measuring body temperature. Welcome to the Cat Post. Thank you so much for joining us today. We are a brand new channel created especially for cat lovers who want science-backed tips and reliable advice for keeping their feline friends happy and healthy. Since we're just starting out, your support means the world to us. If you find this video useful, please subscribe, leave a like, and share it with other cat parents. Together, we can build a community where every cat gets the care it deserves. Now, let us get into today's topic: how to measure your cat's temperature safely, accurately, and without unnecessary stress. Why checking your cat's temperature matters. Cats are known for their independence, but that independence often makes it difficult to recognize when something is wrong. Studies from the Cornell University College of Veterinary Medicine explain that fever is one of the most common physiological responses to infection or inflammation. A fever is not a disease itself, it's a signal. Your cat's immune system raises the body temperature to create a less friendly environment for bacteria and viruses. The challenge is that cats don't exactly walk up to us and say, "Hey, I have a fever." Instead, they keep acting normal until they can't hide it anymore. By then, the illness may be advanced. This is why temperature checks are important. They give us a measurable, objective piece of information that helps us decide whether a trip to the vet is necessary. Have you ever noticed your cat being extra sleepy or refusing food and wondered if it is just a mood or something serious? This is exactly where knowing how to check temperature can give you answers. The normal temperature range for cats. A healthy cat's body temperature is typically higher than ours. If your cat's temperature reads above 103 degrees, 39.4 degrees, veterinarians classify this as a fever. A reading above 104 degrees, 40 degrees, is considered more serious and requires veterinary attention. At 106 degrees, 41.19, or higher, the fever can become life-threatening and may cause organ damage if not treated quickly. On the other end of the spectrum, a temperature below 99 degrees Celsius, 37.2 degrees Celsius, indicates hypothermia, which is equally dangerous and demands immediate action. Keeping these numbers in mind is crucial because even a small shift in body temperature can have big consequences for a cat. Signs that suggest your cat may have a fever. Before you reach for a thermometer, your cat may already be giving subtle signals. Loss of appetite is one of the earliest and most reliable signs. Cats that skip meals, especially multiple meals in a row, are waving a red flag. Lethargy is another strong clue. A cat that normally plays or explores but suddenly spends the day curled up and unresponsive may be running a fever. Other symptoms include shivering, rapid breathing, panting, warm ears, or gums that appear redder than usual. Sometimes cats will isolate themselves, hiding in quiet corners, which is a natural instinct when they don't feel well. These signs don't always mean fever, but they are indicators that checking temperature is the right next step. Have you seen your cat display any of these behaviors? If so, what did you notice first? Was it appetite, activity level, or something else? Share your experiences in the comments so we can learn from each other's stories. Choosing the right thermometer. When it comes to measuring your cat's temperature, the tool you use matters a lot. The most accurate option is the digital rectal thermometer. These are inexpensive, widely available, and give fast readings. Pet-specific models often have flexible tips, which make the process safer and more comfortable. Another option is the digital ear thermometer. These measure temperature inside the ear canal and are less invasive, but research from the Journal of Veterinary Internal Medicine shows that they can sometimes be less reliable, especially if the cat has an ear infection or excessive earwax. Finally, there are infrared, no-touch thermometers. These are designed to measure surface temperature from the skin or fur without insertion. While convenient, their accuracy in cats is questionable. Most veterinary studies conclude that infrared devices should be used only as rough screening tools, not as replacements for rectal measurements. So if accuracy is your top priority, rectal thermometers remain the gold standard. But if your cat is extremely stressed, an ear or axillary device may be better than nothing. Preparing to measure at home. Preparation can make or break this process. Start with the environment. Choose a quiet, familiar room where your cat already feels comfortable. Avoid trying this right after playtime because physical activity can temporarily raise temperature and give a misleading reading. Have all your supplies ready before you begin. The thermometer, lubricant, such as petroleum jelly, disinfectant wipes, a towel to wrap your cat if necessary, and treats for aftercare. If you have another person available, ask them to gently hold and comfort your cat. A two-person team usually makes the process smoother and faster. Most importantly, stay calm yourself. Cats pick up on human emotions. If you're nervous, your cat will be nervous too. Approach with patience and speak in a reassuring voice. The step-by-step rectal method. To take a rectal temperature, gently hold your cat in place, either on your lap or on a stable surface like a table. Some owners find wrapping their cat in a towel works best, creating what many call a kitty burrito. Leave the tail exposed for access. Lubricate the thermometer tip generously. Lift the tail carefully and insert the thermometer about 1 inch into the rectum. Hold it steady until it beeps. Most digital thermometers provide a reading in less than a minute. Remove the thermometer gently, read the display, and immediately clean the device with alcohol. Offer praise and a treat to your cat right away to create a positive association. It's important not to force the thermometer if your cat strongly resists. If you feel significant resistance, withdraw the thermometer and try again later when the cat is calmer. Forcing the process can cause injury or make your cat fearful of future attempts. Alternatives to rectal measurement. Not every cat will tolerate rectal measurement, and that's okay. Ear thermometers provide a less invasive method. To use one, gently lift the ear flap and place the probe into the ear canal, aiming toward the opposite eye. Hold it steady until the device signals that the measurement is complete. The reading may not be as precise as rectal temperature, but it often gives a reasonable estimate. Axillary measurement, taken in the armpit area, is another option. Newer devices like the thermometer are designed specifically for this method. Place the probe in the cat's armpit, hold the leg snugly against it, and wait for the result. This method is completely non-invasive and may be ideal for particularly anxious cats. While these alternatives are less stressful, remember that if accuracy is critical, such as in a medical emergency, the rectal method remains the gold standard. What to do if your cat has a fever? If the thermometer shows a temperature above 103 degrees, stay calm but take it seriously. Encourage your cat to rest in a cool, quiet area and provide fresh water. Do not attempt to give human medications such as acetaminophen or ibuprofen, as these are highly toxic to cats and can cause organ failure. Contact your veterinarian as soon as possible. A fever may be caused by infections, parasites, autoimmune conditions, or even certain cancers. Only a veterinary professional can identify the underlying cause. In some cases, your vet may ask you to monitor your cat at home and recheck the temperature later. In other cases, they may want to see your cat immediately for blood tests or further examination. On the opposite end, if the thermometer shows a temperature below 99 degrees, this indicates hypothermia. Wrap your cat in blankets, move them to a warm environment, and seek veterinary care right away. Hypothermia can result from shock, exposure, or underlying illness and requires urgent treatment. When to visit the vet immediately. There are situations where you shouldn't wait. If your cat has a temperature above 104 degrees or below 99 degrees, head to the vet right away. Also, if the fever is accompanied by severe symptoms such as difficulty breathing, persistent vomiting, seizures, or collapse, this is an emergency. Even if the numbers seem only slightly off, trust your instincts. If your cat simply doesn't seem right to you, it's worth making a call. Pet parents often notice subtle changes before anyone else does. Your observations, combined with an accurate temperature reading, give your vet the information they need to act quickly. Thank you so much for watching today's video on the cat post. If you found this guide helpful, please hit that like button, subscribe to support our growing community, and share this video with anyone who loves cats. We'll be back soon with more science-based, practical advice for caring for your feline friends. Until then, give your cat a gentle pat from us and stay positive.